Do you know India is referred to as the diabetes capital of the world? There are around 80 million people with diabetes in India, and the number is expected to increase to 135 million by 2045. Rising cost of insulin has been resulting in non-compliance in patients with diabetes mellitus, finds an Indian study published in the journal Science Direct. Diabetes mellitus refers to a group of diseases that affect how your body uses blood sugar, that is glucose. Glucose is vital to your health because it's an important source of energy for the cells that make up your muscles and tissues. It's also your brain's main source of fuel. While rising cost of insulin poses a challenge in controlling the disease, the study said the introduction of biosimilar insulin has enabled wider access of insulin with a reduced price of about 20 to 40%. Biosimilar insulin is a biological copy of an original insulin, and there is increasing interest in developing and using them. According to the study published on June 2nd in the peer-reviewed science journal, the rapid increase in burden of type 2 diabetes mellitus or T2DM poses a huge medico-economic challenge, especially when the cost of care is funded by out-of-pocket expenses. The issue is of great concern as India accounts for 17% of the total number of diabetes patients in the world. As per the industry estimates, the price of insulin has increased by at least 50% in the last 4 years. Top 3 multinational pharma companies which control the insulin market in India are Sanofi, Eli Lilly, and Novo Nordisk. Diabetes is a chronic disease and it affects the way the human body stores and uses sugar and other nutrients for energy. The disease restricts the body's capacity to release enough insulin, a hormone released by the pancreas, to keep sugar levels within normal range. In the majority of the patients with type 2 diabetes on monotherapy, addition of another oral anti-diabetic agent is required. Despite these measures, the target glycemic goals are not achieved in the majority of the patients, resulting in various complications, authors said. According to the study, these complications can be prevented and target glycemic goals can be achieved with early initiation of insulin therapy. However, rising cost is a major deterrent to the lifelong use of insulin. This results in non-compliance and further deterioration of glycemic control. Recently, biosimilar insulins have revolutionized the management of type 2 diabetes mellitus and look promising from the economic point of view. By the way, the World Health Organization will initiate programs to make generic versions of expensive insulin injections available to diabetes patients, its Director General said, as he blamed pharma companies for reducing access to the life-saving drug. The scientists who discovered insulin 100 years ago refused to profit from their discovery and sold the patent for just $1. Unfortunately, that gesture of solidarity has been overtaken by a multi-billion-dollar business that has created vast access gaps. WHO is working with countries and manufacturers to close these gaps and expand access to this life-saving medicine for everyone who needs it. WHO Director General Dr. Tedros Adhanom Ghebreyesus once said. Diabetes, once considered the disease of the rich countries, is growing at a faster pace in low and middle income countries now. According to estimates by the WHO, 3 in 4 people who live with diabetes are in low and middle income countries, but they are also the ones with the lowest access to insulin.